Welcome to a Business Minute with Lily Lopez, presented by the South Florida Hispanic Chamber of Commerce. Today we're here at our annual Fashionably Red, which is our heart disease awareness lunch and panel discussion, and we have the honor to have Dr. Joseph Lamelas, who is the chief cardiac surgeon for UHealth, and we've been privileged because we have had him serve on many of our panels, at least for the past 5 years. And just the fact that he's here with us means the world to us. And Dr. Lamelas, you know that now I'm an opinion writer for the Miami Herald, and this column that I'm going to be writing about is about heart disease, because I notice that people don't realize that that's the #1 killer. That's close to 690,000 people die annually of heart disease, according to the CDC. So it's more than COVID, more than cancer. Before we started doing this about 10 years ago, I myself thought it was cancer, and then this was like an eye-opener. But still, I don't see that it gets the attention it deserves, and I don't see people really caring so much about heart disease. Could you tell me, as one of the best doctors that we have in the world, because you are so renowned and we admire you so much, why is this that people don't know that this is a killer?
Yeah, well, it's. I think there's a lack of information out there. I think there's a lack of awareness, and I think events like this are important because they bring, this #1 killer, as I mentioned, out in the open, in the forefront, so people could really realize that this is a significant issue. Many people who have discomfort, they leave it unattended because they think it may be muscular, there may be something from something they ate at night.
Right. Stomach.
Correct. So they just disregard it, and in reality it is from the heart. I've had patients that have had back pain for many years, and they thought it's from their back, and it happens to be from the heart. So I think the key is obviously prevention, and the way you do prevention is by at least having an annual checkup.
And when you say an annual checkup, more than just like for example, an echo or cardiogram, or just blood pressure, or what would be something that people should be getting every year? Because I get my annual checkup, but I don't get anything besides the blood pressure. And you're right, you get the your lungs and the la presión, but nothing else. So how?
Right. Well, I think it starts with the heart rate and the blood pressure, and if there's something bad there, then obviously you look into it further. But on top of that, if you have a history of heart disease in the family, that's very important, because genetics is really important.
Yes, it is.
If they identify, like, again, a problem with your blood pressure, and also if you've had a history of smoking. Right. I mean, that's a very significant risk factor as well. Diabetes.
Right.
So if you're diabetic, history of smoking, any alterations with your pressure, your heart rate, I mean, those would initiate a more further investigation.
And the diet too, right?
Well,
the
diet.
That's key.
Especially a low salt diet and low in cholesterol. I mean, those are very, very important.
And I remember having high cholesterol because my father, he didn't die of heart disease, but he had to have a heart surgery. I mean, he had like 4 bypasses.
Right.
And so then what happens with all these drugs, that they affect your liver. And then I started taking something that's natural, and then my ratio, the good cholesterol, went up, so then the ratio is fine. I know you're a medical doctor, but how do you feel about those, if they're alternative?
Right, I'm a surgeon, but
you're a surgeon,
I don't treat the medical aspect of it, but I do know about it. And you're right, there are some patients that react to different medications different ways, so they have to look for alternative medications. Right?
And I did, and it worked out, and I was so happy because I was scared eventually. Because
but the treatment has to be individualized, which
is
very important.
Exactly.
It can't be one size fits all.
One size fits all, absolutely. And what are you going to talk about today here at the Chambers lunch?
I want to talk a little bit about the advancements we have at UM, and also a little bit about legacy, which I think is important.
Okay.
Which is a little bit different, but it does have a lot to do with medicine, and you'll hear more about that after.
Okay. Yeah. Okay. So anything else you'd like to add? Because this is a short and quick segment, but I'm always honored to have you. I mean, to have Cuban American, that's one of the best cardiovascular surgeons, right, in the world. Yeah, so that means
it's my honor to be here.
It means the world to us. It does mean a lot. So thank you so much always for your time to be with us. And we'll see you next week at the same time. And thank you for tuning in to another Business Minute with Lily Lopez.
Thank you.